Morning, everyone.
Good morning, Marcia. How are you?
Good. How are you?
I'm well. Good morning, everyone.
Good morning.
Good morning, everyone. Just giving some others a few minutes to join, and then we'll get right to it.
Where is that beautiful baby of yours, Alicia?
She is intently watching Blue's Clues, so I hope it stays that way for a little bit.
Oh my gosh, she is gorgeous. You are so lucky.
Thank you. I appreciate that. Yeah, I'm trying to keep her occupied. It's been working so far. I feel like
We
a
aren't
bad mom
not judging.
putting her in front of the TV, but hey, it got to get work done.
The worst part is not being able to volunteer to hold her while you facilitate this meeting.
Right.
But if you want
Yes,
to
by
pick
the
her up,
time this is all done, I always joke that she'll be a Zoom connoisseur by the time we're through with virtual anything, learning, school, work.
yeah. But if you want to pick her up at any time, we will definitely like it.
Yeah, we'd love to see her.
Okay, I will definitely make sure Taylor has a moment today to say hi to everyone. Okay, we have one more minute. So again, just allowing everyone to join, and then we will get started. I hope everyone's having a good Wednesday so far. Good morning, Carmen. Can I tap you to be the timekeeper for today, please? Thank you. Okay, I think we have most on. As others join, they will be able to just jump right in. So good morning, everyone. I hope you had an opportunity to at least start looking at some of the information. I know it's a lot to try to take in a day and a half, but just wanting, again, to make sure that you all were able to access that information. I did get some feedback that some were unable to access a few of the documents just because they didn't have, I guess, the proper permissions. So just wanting to see how many were unable to access some of the documents. I know I've already heard. Was there anybody else?
Last time you said okay.
Winston Mitchell, I wasn't able to access any information to do any reading.
Okay, thank you, Winston. So I will work on ensuring everyone has the permissions needed to be able to view the documents. Today we have about an hour and 45 minutes to get through two major sections or to finish two major activities for the group. The first being the rest of the decision-making process or the decision points that we need to add to the document. We were able to stop about halfway through last time, so needing to finish that today. And then the second part of today's focus will be the essential questions that I believe is around 30 questions that we would need to start and try to get through those today as well. With the essential questions, we do not have to provide an answer today if we don't have them, but for those that we do have answers to, we want to go ahead and populate the worksheet to note that. So I will be facilitating. Marcia will still be the co-facilitator. Thank you again, Marcia, for that. Carmen, thank you for being the timekeeper today. And just a few other items before we get started. So in the previous meeting, it was noted that we will have teacher representation probably next week on the group as well. And I want to thank Victor specifically for, he's not on yet, but he specifically pointed it out to me that he noticed that we were missing that representation, not just from our group, but really some of the other groups as well. So as Dr. Hutchings alluded to, as Dr. Mozingo alluded to, it's very important to have their voice as part of these decision-making processes. So we should have a new member from the teacher side sometime next week. It was also brought to my attention about the formatting of the document. So thank you, Jody, for that. The current document, as we're going through the workbook, I know it seems a little scattered to where we'll have certain, core focus themes in 2 columns and then maybe a different one in the 3rd column. So what I let Jody know is that this weekend I will go in and make sure from a formatting perspective, it all lines up and it all makes sense. I wanted us to be able to get through the meat of our conversations first, and then I will make sure, again, from a formatting standpoint, that everything reads the way that it should read. External stakeholder contribution, I know, Dick, thank you for bringing this up. There has been some conversation about other people who should probably be at the table in some point as we're making these decision-making processes. So I know the police department was one suggestion in terms of traffic controls. We will, as we were talking about transportation and possibly, increasing or really needing to rely on parents to do a level of, bringing their kids to school and picking their kids. How is that going to impact traffic? We are going to have to reach out and work with our external partners, APD being one. Another group or groups that we will be working very closely with in terms of external partners will be RPCA and Campania. And they would be, they're going to be extremely critical for the before and or aftercare conversation. So those conversations are also going to be ongoing simultaneous to our process. So just know that we are tapping into our external stakeholders as well. And Jody, I just wanted to know later on in the week, do I have permission to share some of your feedback that you presented in the document?
Absolutely.
Okay, great. So Jody took some time and went through one of the documents and really provided some great feedback from a perspective, a medical nursing perspective. And I wanted to be able to share that information with everyone because I thought some of the points that were noted there were really critical. And I'll share that document. I just wanted to make sure Jody was comfortable with that and just really want to get your thoughts on that a little bit later as well. So now that we're at 9:20, I think we have everyone in the group. Carmen, we're going to start our 45-minute count now, and we're going to go into the workbook and pick up where we left off. So if you just give me 1 second to be able to share my screen, I will be okay. I cannot get through this. Okay, let's see. Okay, oh, nope, that's the wrong share. Sorry, just give me 1 second. I'm trying to pull this workbook up and it's not letting me do it. There we go. Okay, so John, are you ready to take notes?
Yes.
Okay, great. So we are picking up right here. If you can see my screen, this is where we left off last time. The category right before it was the transportation conversation where we ended last week. So wanting to jump into the next document or the next column for student health. So there was a note put in the document and I really need some more clarification, but it was impact to students outside of our district that may not go back to a traditional model. So I'm not sure if anyone from the student health group really wants to speak on that or provide a little bit more context to what it is that we meant, because I think that that will help us with the decision points that need to be made for this particular item. Marcia or Dr. Gerard, does anybody know specifically what we were focused on right here?
I am not sure. Impact to students outside of our district. The only thing, if folks were talking about students who may be experiencing homelessness that may be outside of the district or students who may be in private placement, I can only assume that might be what maybe that means.
Correct. Agreed.
Okay.
Okay, so John, can you just add the notes that this is in regards to either homeless students or private placements?
Do we know where that came from originally?
It came from our smaller core group before we were able to add all of the additional stakeholders to really make this group comprehensive. There were a few of us that had already started to note themes, Jody, and so this was one that we probably noted about a week ago. But given the fact that it's been a week since we notated this, I just wasn't sure specifically what we meant by that, because we were literally just kind of having a brainstorming session at that point.
Makes sense.
So do we have any decision points that we want to note for this particular item? And I can't see hands, so Marcia, if you can acknowledge anyone that has their hands up, please.
See here, let me get to that function. I do not see any hands raised.
Okay. So I'm thinking this can be an item that we come back to because I don't want us to be stuck on that too long. We can come back to that and note any additional decision points that we need to make. The next item is in regards to, again, student health, and there was a recommendation that we could potentially use the Academy of Health Sciences students to support temperature screening. Two of the decision points that came automatically from that thought is, how do we maintain HIPAA compliance if we are using Academy of Health Science students, and will those students have to sign a waiver of any sort to assist? So Manya, I see your hand raised.
Hi, thanks so much. So I wanted to go back to this, and I know we talked a little bit about this last time, but there's a lot of data to suggest that the temperature screenings are not that effective, and even the AAP guidelines don't think it's that critical. There are tons of people who are sick without a fever. Temperature taking is flawed, and I really think we're putting kids at, actually even adults, if we screen them, the kids are waiting in line, we're really putting them at more risk by making them take the temperature, and it's probably not that useful. And I definitely would be adamant about not having other children screen. That seems like a very bad idea for a lot of reasons, including the safety of the children who be screening and the Academy of Sciences. So, I mean, I think we could slice off a lot of things by saying moms or dads have to take the temperature before they leave. If they are febrile at a certain level, then they can't come to school. But stop thinking about this as something that would engage other people. It just puts everybody at risk in terms of confidentiality and also COVID risk. So I would defer to the physician and here, but and the nurses, but I just wanted to throw that out there.
No, I think that that's actually a great decision point that we will need to make, Manya. There is a lot of back and forth regarding if we should even do screening or if we should allow individuals to self-screen prior to school. Just for the reasons that you've noted, I see that many of the nurses in the chat agree with that. So I'm sorry, I can't see whose hands were raised, but I do see that there were two other hands raised to add to this particular theme.
Karen has her hand raised.
Okay.
I concur and would defer to the health professionals, the physicians and nurses online. I'm not interested in exposing us to additional risk for temperature taking, which seems to be really more of a comfort. We're doing something. That's why I think the public likes it so much. But I did want to note that I am in favor of figuring out a way to deploy the asset of the Academy of Health Sciences, not just to students, but the faculty in the partnership with GW, because we're going to need a lot of other extender services. We want to make sure that our nurses work at the top of their license, providing whatever is care. There's going to be an awful lot of documentation, things that are going to be addressed around attendance and other quality impact type of things. It would be wonderful experiences for the students and safer for them to be on that part. And I suspect by the time we get to budget, we will not have carte blanche and trying to hire the volume of staff to address all these other types of functions we'll need to provide. So that would be a great role for this type of partner and our partners at Nova, their Springfield Medical Campus. I know we partner with the Alexandria Nova campus, but that might be another place for their nursing students to extend the partnership that we already have to increase our bench strength.
Karen, would you mind also sending me those potential partners, just emailing me those potential partners so I can make sure that I'm documenting those names correctly in our document, because I think that that is a great point. Wanting to really tap into our community resources that can help support any effort that we put forth, I think is extremely important. So thank you so much for that. Marcia, did you see another hand? Because I did want to
Yes.
tap Dr. Sinha and Dr. Gerard and just get their thoughts about the screening piece.
Absolutely. Shemaine Moore has her hand raised. And then
Okay.
Bessie.
Good morning, thank you. Just a consideration, if the ultimate decision is for parents to do screenings at home before they go to the bus stop, before they drop them off, that we do have some working parents who either work overnights or due to their schedule, they're not there when the student's getting ready in the morning. So just a consideration that every parent is not there when students are getting ready in the morning, or would we allow like older siblings to check younger siblings? I don't know where the line is, but that was just a thought if we ultimately go with parents.
No, thank you. That's again, something that I hadn't even considered, but you're absolutely right, is that if we do employ the self-screening for those that are unable to, do so before they go to work, how are we going to make sure that that particular child has had the opportunity to be self-screened?
All right, I see Bessie's hand and then Carmen.
Okay, Bessie?
All right, I just wanted to make a point. This summer when the nurses had to go in and actually do the temperature taken with the infrared thermometers, those thermometers it was funny to me because they actually read everybody's temperature at about 95.6. And that can't be possible. So if we are gonna use that, and that is the safest mechanism of screening for the children, but I agree with Karen 100%. Temperatures is not the gauge to go on. But if we are to do that, we need to make certain that those thermometers are calibrated so that they will read other than everyone having the same temperature.
Thank you, Bessie. And I do know, I think I've also heard that the temperature can impact the readings on the thermometer. So if they haven't had time to acclimate to either room temperature or whatever the standard is, that they can definitely skew the reading. So I've heard that feedback as well. Just want to check the chat for a second. Okay, Manya, I see that you're agreeing with what Bessie has said. And then thank you, Michelle, in terms of hearing aids can also impact the temperature. So Marcia, I think there were a few others that had their hand raised.
Yeah, Carmen's hand went down, so I'm not sure if she still has a comment.
No, someone stated what my comment was.
Okay, thank you. That's it for the hands, except I still see Karen and Bessie's hands raised. I don't know if they just forgot to put them down.
Okay, great. So Dr. Sinha and Dr. Gerard, I'm just curious to have your feedback as well regarding the screening piece. I think that this is going to be a huge decision point for us as a team as to whether or not we are going to recommend eventually that we do on-site screening, or if we're going to go with the self-screening. So just curious to hear your feedback on that.
Yeah, good morning, everybody. Thank you. The points you raise about the temperature screening is correct. Thermometers have to be calibrated. If it's too hot, they may not read. If it's too cold, they may not read appropriately. If somebody has been standing outside in the hot sun, the temperatures may give a false positive. And so false positives and false negatives are high with temperature screening. However, I do think that, because the symptoms of COVID are so nonspecific, they are very similar to multiple other disease processes. The purpose of any screening tool is really to kind of be an initial check. And if somebody rules in or screens in with a screening tool, then the idea should be that a further confirmatory test should be done. We do that all the time in other, like rapid flus and swab tests and so forth. So, we have to take into account the limitations of temperature screening, but I think the best way to screen people at this point is to use a multi-pronged approach. We need to have self-identification of symptoms. Some of the work that I've been doing with Fairfax County, they've talked about sending out just information sheets to the parents about, what are the symptoms, lack of smell, cough, cold, things like that. So I think we have to use a multi-pronged approach, but I do agree that one individual screening tool is not the end all be all. But I don't know if we are at a point yet where we can say that screening for temperatures is more detrimental than beneficial. I just don't know if we're there at that point yet.
Okay, thank you. Dr. Gerard, did you have anything you wanted to add?
So temperature screening is the only objective measurement that we have from doing a lot of volunteer work with COVID tracing. There's so many other symptoms that children can have that may or may not be indicative of COVID or any other disease process. But as temperature screening is the only objective measurement we have, I think that we should stick with that. As far as doing it at home, I think that could work fine. The question that I have is, if we have a third of our students who would be attending school and they register a temperature that's above 100, how do we get that information to the school to let them know that they'll be absent? Is there an online form that they submit? Is the administrative assistant in the office coming in to receive, tens or hundreds of calls that these students will be out? There has to be a process to let the school know that that student is absent for a fever or symptoms that could be indicative of a contagious illness.
Thank you. And Carmen also raised a really good point, is that for our students that may not, and I know thermometers may seem as a general, household item that most people will have, but we also have to keep in mind that there will probably be students that don't have access to a thermometer at home. So how do we, if we're employing solely self-screening, how do we make sure that those students are still having an opportunity to be screened, and just the equity in the process that we employ? I think we're always going to have to keep in the back of our minds that some of the things that we may take for granted as people having access to, they may not necessarily have that, the same access at home. So I think that that's a great point. And something that came to me yesterday outside of the group that I wanted to quickly gauge is, I had a question regarding how soon can symptoms appear? So the question, the context of the question is, if I send my child to school and say one of their classmates, passed the screening in the morning, but somehow or another started showing symptoms of COVID during the day, how soon would those symptoms present if we went with a hybrid model? Could you ever truly be sure that any screening mechanism that you put in place would catch anyone that potentially is showing signs of COVID? Maybe they didn't have them in the morning, but by the afternoon they're displaying symptoms. So I'm not a medical professional. Of course, I couldn't answer that with any specificity, but just wondering and wanting to hear, I've heard a range that, from exposure, it could take up to, 48 hours technically to start showing any symptoms, but then you have those that are asymptomatic, you have those that it may take longer for the symptoms to show. So is there any standard, guidance or evidence regarding that time frame? And I do believe Manya had her hand raised. So I see that, Manya. I just wanted to get that question answered really quickly, and then I'll jump to you as well.
Great, thank you. So you're correct. It's a very wide range. So from exposure, the incubation period before a patient shows symptoms can be anywhere from 2 days to 14 days. The average time of showing symptoms is 2 to 5 days. So that's the average, but it's a huge range, as you can see, and that's part of the problem. And again, that's assuming that somebody is symptomatic and not asymptomatic. So I don't know, hopefully that helps.
No, it helps greatly. And I think that the person who asked kind of wanted some guidance to say, would this child, display symptoms the same day? And to your point, I don't think we can ever say that with any level of confidence. It just depends on that child, immune system, so on and so forth. So no, thank you for that. Manya?
Oh, wait, can I?
Yes, I'm sorry, Dr. Gerard.
Oh, sorry. I'm so sorry, Manya. I did not mean to speak over you. I'm so sorry. I didn't raise my hand in the right way. Can I go ahead and go?
Yes, go ahead, and then we'll get to Manya.
I'm so sorry. One of my nurses, Jennifer, who is excellent, reminded me we had recently partnered with a thermometer program called KINSA, K-I-N-S-A. The way that this works is that information pamphlets about this free thermometer program would go home to all the students of elementary schools in the fall when we are back, and parents fill it out. And what happens is whoever fills this out that they need one, then the thermometers would be sent from this KINSA company, which is sponsored by Lysol. It would be sent to the schools and then sent home in the backpacks with all the students. And the thermometer, if a family has it, could also register with an app on a smartphone. And so we could see that if my parent chooses to enter my info anonymously, that Elaine Gerard today has a temperature of 100.4 and she's staying home. It wouldn't say the name of the pupil, but it would register the student anonymously on a nurse dashboard on her school-issued laptop to say, we have 25 third graders at Lyle Crouch that are out today. We have 10 sixth graders at Jeff Houston who are out today due to fever. So we can monitor trends that way. That's just one option. And Jennifer, thank you so much for sharing that info.
Thank you.
The only issue is that they wouldn't go out until the fall, but it is free to our school and free to the parents. There is no cost to us. So we registered for that in April. And Jennifer put up the link.
Thank you so much, Jennifer. And thank you, Dr. Gerard, for noting that as a resource. Manya?
Sure, I'll just go off of what Elaine just said, but that actually, the KINSA, if you look at the link and you can see the heat maps, because those actually send data to a whole demography, you can actually see the heat maps generated by those temperatures. They're not kept private, so the privacy issue is pretty something to consider. But they're actually amazing. You can see the whole COVID epidemic play out by fever and population level on that site. So that's one of my favorite data tools, actually. But what I was going to say is that right now we're thinking about everything in terms of screening, having some follow-up action. Some follow-up action would be to stay home. Yet we know, we just were talking about, Vivek mentioned, we have like a totally uncertain amount of time. So if you have a cold, you stay home for 14 days. Who's taking care of the child? There's a lot of things, even having the sniffles may not be actually the right way to approach it. We could end up easily having a situation where a kid has an allergy. We make them stay home for 14 days till we prove that they don't have illness. So I think that everything so far that I'm hearing is definitely on the individual level, like what we're doing for one person, we're doing for everyone. But I mean, I'm an epidemiologist, so I see everything on a sampling level. And doing a random sample by class, by school, so every day 10% of people, for example, staff, teachers, principals, children, paraprofessionals, it gets tested in some way. So for 10% of the people, we have, nursing students, other people come in and screen them. But then we get it, because we've done a random sample, we can actually try to understand what's happening on each school level. And if the school gets worse, so they have a peak of symptoms, fevers, testing positive, family members, then we say something has to change in the school. So everything is triggered instead of by the individual level. We do a sampling and do something on the school level. And I think when we think about something outside of the normal, that going to this direction would be very innovative, but also much more effective. Because there's no way we're going to be able to use an individual level to say, oh, everybody should stay home if they have a sniffle. Nobody will come to school because kids are constantly sick. But if we do it on a sampling level and do a more like a deep drill onto each person's symptoms, I really think we could say, okay, 10% of people come in, they have a fever, they have a full symptom screening, they could even get tested with the Alexandria Health Department, then we get some sentinel testing, and we would be able to manufacture approaches on the school level, like there needs to be more outside time, there needs to be more separation, there needs to be more distance. And if things are going well on the school level, we can also say, you kids did great. You're doing so awesome. Let's do you can have more closeness. You can be 3 feet instead of 6 feet. You don't have to wear your masks if you're outside. So I just would advocate for thinking not on the individual level, which everything I'm seeing so far and all the school districts are, and think on the sampling level. And we can help you do that. That's what we do.
Okay, thank you. I see John had his hand raised.
Yeah, I'm sorry, I took it down. I was just gonna make a couple of comments, but I'll write them in. I'm not sure if I should even comment right now.
Okay, Marcia, did you see any additional hands up?
I do not see any right now, no.
Okay, so wanting to then move on to, so I think we got a lot of good information on that item. So there was a note about, and this really would cross the cross-functional planning teams, but internal and external stakeholders understanding how we align, with the individual model structures, or understanding how they align with the individual model structures. So with that said, I know I had noted, and John, you can put this in the document, that we will be doing a level of outreach to external stakeholders, APD, RPCA, and Campania. Are there any other external stakeholders that you think either our group or all of the teams need to make sure that we are having a level of outreach and a level of collaboration in regards to the reopening plan? So do we think that those groups are good to start with, APD, RPCA, and Campania? Okay, I'm not hearing or seeing any comments, so I think we are, let me check the chat. Okay, I see Alexandria Health Department. Thank you, Manya, absolutely. And thank you, Carmen, for the time check. So we're at about 25 minutes left for this section. Okay. So then wanting to move on to the next theme, which is in relation to transportation, the installation of technology screening tools. So again, this goes back to our screening questions. Okay, and whether or not, if we are going to do, oh, sorry, if we're going to do any screening, especially if we're going to start the screening on the buses, do we, again, use the thermal thermometers, or do we go with some other sort of technology that is like a portable standing screening tool? I had some individuals tell me that there were these different tools that are available, but one of the major decision points is that we cannot do much of any type of reconfiguration of our buses, because that could potentially deem them unable to be driven on the road. So that would be a huge problem. I'm going to ask Afia to speak a little bit more to that piece, but Dr. Gerard, I see your hand is raised.
Hang on, unmute. Okay, so if we do the screening at home, wouldn't that negate the need to do this? Okay.
Yes, I think that there was the assumption that we would do some level of on-site screening, but again, it's going to have to be a decision point. If we decide as a group, nope, we're not going to do that, we're going to just self-screen, then this will be a moot point, but still wanting to make sure that we at least document any decision points if we do go with a level of on-site screening. Kind of circling back to the question, is the first point of screening at the bus stop? And if so, are we now going to ask bus drivers to be the ones that are taking temperatures? What ways can we mitigate their exposure of doing so? So just wanted to make sure that we were capturing that as a theme as well. I see that there are a few hands raised. I can't see who they are, but Kafaya, before we get to those hands, is there any information you want to add regarding the reconfiguration or installation of any items on the buses?
Yes, good morning. Sorry we are late. We had an issue trying to get to the links.
You're fine.
Screening the students at the bus stop, first of all, that means our driver has to get off the driver's seat, secure the bus, turn it off, because he cannot be standing and walking around while the bus is running. Has to have the stop sign, the red lights on while he's doing this. Problem would be also if we can't add any equipment to the bus. It has to be approved by VDOT. We cannot add anything to the buses. It has to be manual. Someone has to manually take the screening test. Because the law, they're pretty strict about we can't even put signs inside the bus or outside the bus.
Okay, yep. So thank you for speaking to that. Dick, I see your hand raised as well, but to that point, I think that this then ties back into the ultimate decision that we need to make regarding the feasibility of being able to do on-site screenings. And if they start at the bus stops, to Kafaya's point, the level of, I don't want to say work, but the level of, action that a bus driver would have to take in terms of, making sure the bus is secure, stepping off of the bus, having to screen, one and or multiple students that may be at the particular bus stop, the time that it will add to, the route, the traffic that could potentially back up behind the bus while doing so. So a number of considerations. Garcia, there were a few hands raised prior to Dick, so I just want to answer those in order, and then Dick, we will definitely get to you.
I saw Michelle Hopkins' hand raised. Michelle?
I guess my question is also how sure we want to be about the data that we're collecting. I know if we require self-report, I know with survey type of data, that's one of the lowest ways of getting responses back. I'm not saying that there are a lot of factors that we cannot control. So if our goal is really looking at making sure that students are safe, if we can't do it on the bus, maybe consider when students exit the bus or whatever, but it depends on, I'm just saying that, some parents may report, some parents may not, and then there may be, I've had situations where we've had parents send students to school when they know they're sick because they have childcare issues or some other things as well. So it just depends on how, what kind of data we want and how consistent we want it. So that's another question I just want us to consider.
That's a great point. And then also, I just think tying back to that, Michelle, is just what is our risk tolerance? Because to your point, if we know that we already have parents that, send their children to school sick, there's going to have to be a level of trust that we are, putting into the results that we do get back and saying we 100% trust these results, or there is going to be a percentage that we know will probably not be quite truthful. And then, are we willing to take that risk as a division to say, well, we're putting that trust in the parents to accurately report. And then, what does that end up meaning for the division? So I think that those are all good points. Marcia, did you see any other hands before we get to Dick? And I do know Dick has to drop off early. So if the others have long questions, I would ask if you all don't mind if Dick can jump ahead of the line so he can get his question in before he has to get off. Okay, Dick?
Thank you very much. I have two concerns that I want to bring forward. They're not so much questions as things that we need to really think about. First of all, from a purely safety focus, adding a responsibility to the bus driver for monitoring the specific health of each student at this point is a distraction that could possibly impair the driver's comprehension of the other circumstances he deals with in other ways. And I know that a lot of people think this is simple, but if you're driving a 95-foot box on a 12-foot wide path in the middle of rush hour traffic and you've got 25 kids on board, you don't want to be thinking about anything except trying not to have an accident. And I'm giving you that from my own experience. So I think that trying to approach this a way that the monitoring is going to become a part of that responsibility and occur at a point on the bus, I don't really think that's a very good idea, folks. And the second thing I wanted to bring out is there is some excellent tracking technology available for being able to keep track and monitor the exact location and other characteristics of a specific package. Now, I know I don't want anybody thinking I'm referring to kids as packages, but the truth is that if we were to ask our incoming neighbor, Amazon, for a consultation on this matter, they may be able to recommend a technology solution to tracking which students are where, when, and what happened to them that day, fairly inexpensively, maybe even talk them into making a contribution to solving our problems, since they're going to be such intimate neighbors in the next few years. But I don't think that it's purely a COVID solution in that regard, but I think it's something that the school district's been needing to do for some time. And I appreciate Ms. Kafaya's suggestion that it might not be a good time to talk about making any alterations to our systems, to our buses, to the physical realities. But I don't think we need to rule that out. That's all I'm saying.
Okay, thank you so much, Dick, for those comments. Marcia, I think there were about 4 hands that I saw pop up during that piece, so.
I see Carmen and I see Bessie's hands.
Okay, so Carmen?
So good morning. And to Dick's point, I 100% agree. I think that as a part of what we could possibly do to keep that from being a bus driver's responsibility is really focusing on the parent support in regards to students wearing PPE to bus stops and on the school buses. And I'm not sure if, you know, as a part of the Health and Safety Committee, we would cover that. Maybe that's more of a family engagement, but I think that if we have required students to wear the PPE, we get them safely onto the bus, and then when they get to the school, the screening takes place, you know, and I think that would be much more appropriate than having our school bus drivers to do it.
Thank you, Carmen. Bessie?
I would agree with Carmen, but I would disagree with one part. We know I've been a nurse at Hammond for 12 years, and I know for a fact that parents will give their children fever reducers so that they can come to school. So if at this particular point we're saying that their temperature is not checked at the bus stop prior to coming to school, then of course we risk the exposure of, and I'm not just talking about COVID, I'm talking anything, you know, it could be a common flu at this point, then we've exposed those children. Anytime that we have a child in the clinic and that has a temperature, we cannot put that child on the bus. So we have to still look at this when we're doing our assessment, even prior to coming to school. You have to understand, if that child has been given a fever reducer, it does not say that they're not contagious at this particular point. It just says that that temperature will not be shown at that point. So we have to be very careful that we're considering all the student on the bus if we are putting children on the bus prior to having that information of whether or not they have a temperature. And I mean, like I say, I'm a parent first, and I do understand it's gonna be hard. And like I said, I've been there for years, so I do know it's hard for parents, and some parents are gone at 5 o'clock in the morning. So who will take the responsibility of checking a child's temperature? But I just wanna look at every child, we have to look at the safety of every student before they put their foot on that bus. And I don't know financially if there's a way. I think Elaine said something in the chat the other day about getting someone to be on the bus. And I understand that the bus driver maybe cannot, but is there someone else that a bus aide, or I don't know, is it something that they can do while they maintain the bus driver, and the aide can do the screening? I don't know.
Good points as well, Bessie. I see a few hands popped up as well, and I want to just be conscious of the time. It's 9:56, so I think we still have about 4 or 5 categories or themes to get through. I'm not trying to shorten this conversation, but just want to keep everyone aware of that piece as well. So who's next, Marcia?
I saw Victor and then Kafaya.
I'll try to make mine brief. You know, I don't disagree with Bessie's, you know, assessment, but I think the point that was made earlier as pertains to not doing quote unquote wholesale, but really having a 10% or a partial approach as we kind of go through what that looks like in our building. But I also want to look at the equity issue with that, as far as if we're wanting to make sure that we test every kid or screen every kid that gets on the bus. Are we not doing that for our walkers? Are we not doing that for our kids that drive to school? Because at least at our school, sadly, it's going to come down to a racial issue as well. Like the majority of our kids who ride the bus look like me, and the kids who walk to school are white. And so that could be we're not testing the kids that walk or ride their scooter or ride their bike or, walk their dog to school. I think that could be an issue. So if we're going to say all, it has to be all. To me, I would just have an issue with that. So secondly, as I said, if we can do it on the bus, I still think that's possible with the whole 10%. Let's just say we have, 20 kids or 30 kids on the bus, depending on what the social density look like. It's not a lot of kids that you would have to use the little hand screen that we would have with. It wouldn't be a lot of kids that you would have to do that with. We have a roster. We can go through that roster every day. A different kid gets screened. If we're talking about maybe 4 or 5 kids a day that would get screened as far as that same theory, as far as 10%. Why not have that same alignment with the bus or with the front door when kids are walking to school as well, or whatever that may look like as far as point of contact? So in my mind, if we're going to say a 10% is something that we're looking to do, I forget how it was articulated earlier and I forget who said it, but my point is if we're going to have that same model in the building during the day when the kids are already there, why not have that same model with the bus or the first point of contact with the front door for all kids and have that consistency, and then do some type of rotation as far as randomness, as far as that selection, so that it's fair and equitable, at least from my perspective. And maybe it needs to be hashed out a little bit more, but I'll shut up because I can be long-winded. I know we've got a short amount of time.
Oh, no, I think, Victor, that's a great way to bring this back around to the equity piece of the conversation. Again, we have a whole other subgroup, walkers. We have those that would be taken to school by parents that we haven't even considered in terms of how we're going to get their temperatures screened. So I think that was an excellent point to bring up. Marcia, were there other hands?
Let's see, Kafaya and then Sarah Bennett.
Okay, Kafaya and then Sarah.
Okay, back to the question of having monitors on the buses. That's going to be a costly issue. Our buses we only have 30 monitors on the special needs buses. If we have to put one on every bus, we're talking about hiring between 80 to 90 monitors. That can become costly. Also, we've had issues where our drivers and monitors are very reluctant to be that close to a student because of no touching. Oh, he touched me. It becomes a liability for these drivers and monitors if a student went home and said they hit me with a thermometer or they touched me on the shoulder. It's a big liability on the drivers and monitors. And cameras are not on all the buses where we can view a camera and say, no, they didn't touch them. Then we have to call CPS and it's an investigation. So I believe that we really need to take that drivers testing the students and we have to realize if we're going to be only transporting between 12 and 20 students on each run, that bus is going to do at least 5 runs at some of these stops. They're not going to be able to take all the kids from that one stop. They're going to have to do at least 5 to 6 stop pickups and drop off, come back, pick up and drop off. And then the cleaning in between. Because if we
it's going to be a massive lift if we do it that way. I absolutely agree, Kafaya, on that. And so I think as we get to the part of the conversation where we're making these decisions, we definitely have to end up making the decision in terms of how do we screen, and then, or if we screen it, and what that looks like, whether it's going to be sampling, whether it's going to be screening everyone, what does that translate to from a budget perspective, and who ultimately would be the person that is doing the screening. So I think that those are all decisions that still continue to need to be made. But I thank you for, continuing to emphasize the challenges that would be on the transportation end of things if we do it from the bus driver standpoint. So, Sarah?
Hi, good morning. I think one of the concerns that has not arose with, bus driver screening is that say a student is running a fever, and what is then to happen with that student? They're turned around, they're not allowed on the bus, and then they're just left there. Bus leaves. What I think in safety for all of our kids, I certainly wouldn't want to also be the one responsible for turning away a student for getting on the bus at which I could safely transport them to a school. So if they were riding a bus with a fever, fever or not, they're being exposed. I couldn't see it being right that we would turn a kid away and just leave them standing at a street corner on our busy streets to not have a safe place to be.
That is a great point, Sarah, and one that I thought we had noted in the notebook, but thank you for reiterating that, is that how do we, or what would be our process for dealing with a child that may have an elevated temperature? We don't just leave them at the bus stop, especially given some of the points earlier made in terms of work schedules for parents and so on and so forth. So that's a major concern that we need to make sure that we're taking care of as well. Marcia, are there any more hands raised?
I saw Karen's hand for a second, but then it went down. So Karen, did you have a comment? Okay, thanks.
Okay, so wow, that was a great conversation on the transportation piece, wanting to keep this momentum going. And the next theme really kind of involves 3 different areas: school nutrition services, custodial, and student health. So students eating in the classroom as opposed to cafeteria, and how to safely manage that, for instance, increase in trash and possibility of rodents, and students that have allergies that are now having to eat in the same space. So a few decision points that have already been noted for this theme is how will we ensure no cross-contamination for those with food allergies if they are serving and eating food in the same space? Who would be responsible for collecting food trash after each meal? Would that be school nutrition services or the custodians? How would we increase our pest control treatments and abatements with students eating in multiple classrooms? And then how would food be covered and served to students? So Manya, I see your hand raised.
Oh, hi. Just to say that, if we're keeping people, we're focused on keeping people out of the cafeteria and stopping the crossover, and that's going to it's going to be very important in terms of what we see at the middle schools and high school, especially. I mean, we have to look down at the point of having people stay in their classrooms, which is to reduce change of the cohorts to keep the kids sort of in pods so that they don't infect each other as much as possible. But I would say this decision about where people eat is actually a big decision in terms of all these issues. But if people are going to be just changing classrooms and mixing each other up, I don't think it's even worthwhile, because we've basically then said there's this one big change without other changes. So I would suggest that we really also make sure we're focusing on the whole movement between classes. If we have a chance to keep people in one classroom or have teachers virtually pop into different classrooms to the kids as needed, or I don't know, there's a lot of creative ways of thinking about it. But until you're assured that the kids are not moving between rooms, this is a huge thing to change the eating paradigm without even changing other things that I think are also really, really important. So I just would say this goes hand in hand with that, because
Absolutely.
This is, a lot of work.
And to that point, I believe the SEAL team, which really is heavily focused on the curriculum instruction, is considering limiting or possibly saying no transitions from classroom to classroom, to do that pod model or to do that cohort type of model when we return back to school. I don't believe that a final decision has been made on that, but I do know there have been certain recommendations like no limiting or reducing or completely eliminating any transitions between classrooms, one directional hallways. What does that look like again for eating in the classrooms, in terms of we're trying to limit the movement once they are in the building. So then the theory would be, or the thought would be, okay, so we need to serve them in the classroom space. Again, that hasn't been decided, but I can tell you with a level of certainty that those items have been brought to the team. They're going to work through that. But I do believe one of the recommendations will be to not have that transition or to limit it as much as possible in the schools. Absolutely. I see Cindy, you had your hand raised. I'm not sure if somebody was before you, Cindy, but I'm going to jump to you.
You know, I'm hearing back from a lot of principals, and just want to also put that in, if we are to deliver food to the classroom, as opposed to trying to set up some type of methodology by which they could come to the cafeteria or different maybe hall spaces where we could bring the food, it's going to require a heavy lift and cost burden of purchasing a lot of equipment that perhaps after COVID is done, we won't have any use for this equipment. So as we're doing this and we're planning, you know, I've had a couple of conversations with some principals, and their concern is about, you know, perhaps having people in the classrooms for long periods of time, and that perhaps a break coming, having them walk into a cafeteria space to pick up food and then return to their classroom might be viable. You know, we just need to know, and as everybody needs to know, we need to know this information as soon as possible so that we can move forward in whatever direction. But just keep in mind that if the expectation is to deliver meals, I'm hearing more about this in the elementary school setting, but if it is to deliver meals to the classroom, it will require a lot of additional pieces of equipment, small equipment that will need to be purchased for this endeavor.
Okay, thank you for that, Cindy. And to your point, I'm interested in hearing from the principals on the line. What have been some of your thoughts or your conversations with your peers regarding this particular subject? Victor, I see your hand raised.
Yeah, I would say, and I know Ingrid is on here as well. For me, I don't think a one size fits, you know, approach would be, you know, something that I would want. You know, I think we have, because we're a really small building, we could do, you know, some students for that grade level are eating in their class, or some students are eating in the cafeteria to kind of deal with that social distancing as well and have a rotation. I know a lot of our schools already do breakfast in the classrooms, whether that's, you know, in the morning on a regular basis. So it's not something that I know our colleagues aren't familiar with as far as having our kids eat in the classroom. But I think having some type of hybrid model of that, you know, I would be for. I'm not necessarily 100% sold on just the whole year having our kids just eat in the classroom, or obviously just in the cafeteria as well. But those would be my thoughts, at least at this point. I know Ingrid is on here as well.
Yes, Ingrid, I don't know if your hand is up, but I would love to hear from you on this item as well.
Hi, good morning. So I agree with Victor. I know for just the particular buildings, the old Patrick Henry, it probably works great for food to be delivered to classrooms, or for children to take food back to classrooms, coming to the cafeteria, getting it, and some type of hybrid of having food in the cafeteria. I know for the new Patrick Henry, that doesn't work at all. Our cafeteria is very far from the classroom wing, and we have 3 floors. So the propensity for children to drop lunch is going to be great. And so I wouldn't want a cookie cutter approach as well. I think I agree with Victor that we need to have it school by school in some type of hybrid, taking each, you know, no cookie cutter plan. I think we need to decide what works best for each population, the safety, timing, and of course, social distancing.
Okay, thank you for that. And just for my clarification, when we're saying hybrid approach, are we thinking about children being able to get their food from the cafeteria but bring it back to the classroom, or are we actually speaking of having some children physically eating in the cafeteria?
Yeah, both.
The physically eating in the cafeteria.
Yeah.
Okay, okay. So I just want to make sure, John, that we're noting that as well, that when we're talking about the hybrid, it's not just potentially allowing students to get food from the cafeteria, but also some students eating in the cafeteria. Okay, great. So Carmen, I don't know if you had anything to add to that particular, okay, I see that you said that you agreed. Okay, so that would be the purview as well from the high school level. So are there any other hands raised for this particular item?
So just to let you know, Dr. Hart, that our time in this particular section has ended. So,
okay. So we have 1, 2, 3, 4, So we have 6 more themes to get through. I do want to try to highlight those very quickly to see if we have any feedback. And then some of the homework that I will ask everyone to do is if there were any other decision points that we didn't get a chance to speak about today for these other themes, that you all send that to me offline. We can add them to the book, and I'll make sure that we're able to speak to those very briefly the next time we meet, because we do need to get to the essential questions as well. So thank you for that time check, Carmen. Wanting to jump very quickly to the next theme, which is the cleaning process as students transition between classes in restrooms. What would be the implications for staff as well as teaching students to also be part of the cleaning process? So that question or that theme is, it's worded a little weirdly, so I'll fix it. But in general, you know, wanting to speak to the transition piece. So if we do have transitions in for students to move to different classrooms or different areas of the building, what does the cleaning in between those transitions look like? You know, would a custodian or whoever have to come in and now wipe down every single surface of every single room in between transitions? I have looked at some other school plans, and for instance, some it is a team approach where yes, the custodians are doing the high touch area cleaning, but they're also expecting teachers to participate in some of that cleaning as well, to wipe down their desks, to wipe down any other areas that may have been missed on a more frequent basis. So some of the decision points that go along with this particular theme is how long to clean each classroom in between, or how long it will take, excuse me, to clean each classroom in between transitions. So making sure that we're building in enough time for that cleaning to be done. How will that ultimately impact instruction? How many custodians would be needed per school to achieve cleaning classrooms in between transitions? So we know that we have a set number right now. Would we need to increase the number of custodians, more than likely through a contract, it means, in order to achieve this level of cleaning for transitions that would take place? Will teachers and or students assist with transition cleaning? What PPE would need to be provided in order to do that? How will we enforce social distancing in restrooms? So this is major, especially for our smaller kids. We think, of course, older kids would have a better grasp on social distancing and be able to self-monitor that to some extent. But our smaller children, we know that this is going to be a challenge. And how often will restrooms be cleaned throughout the day? Will we remove hand dryers from restrooms? There's been conversations about, you know, hand dryers being one potential cause of spread, you know, so what does that look like? Are we now just going back to a full paper model in our schools? And will we install toilet seat covers in all restrooms? That's been another point of conversation that I've seen some other school divisions go through. And should we provide portable hand washing stations in each facility? So this is something else that I've seen other school divisions doing, providing these portable hand washing stations throughout the facility, to where if a student or a staff member ever finds themselves outside of a traditional hand washing space, that they still have the ability to do so. So I see a few comments in the chat. Just want to get to those very quickly. So yes, cultural norms, we do have to, you know, speak to how that's going to change and what that will look like. And again, what will be the implications for teachers and students to help with the mitigation of spread of COVID. You know, green school status, that's absolutely a great point. So great, Cindy has noted that we already have some extra portable hand washing seems to have needed, and they have already been purchased. And who will provide all the PPE? So that's on our group, Nicole. When I say our group, our department, facilities and operations, we are being tapped to provide all the PPE. Will there be cleaning supplies that children can manipulate safely? That's a great point. So these are all considerations that, or decisions that will need to be made regarding the cleaning classroom space.
Dr. Hart, this is John. I thought the PPE was Mark Carlson's group.
Yes, but that, I'm just, for the group in whole, that falls within the purview of facilities and operations. So yes, Mark and Ruth, they're the focus leads for that particular item. But in terms of who's actually purchasing it and providing it, that's, you know, our department. It'll be funded by our department. So I don't know if I see any other decision points that need to be added to that particular theme. Again, you can send those to me offline and I'll make sure that they're added. The next item we've talked about briefly to some extent, wearing of masks for younger students and safety concerns. So we've talked about the age in terms of when it's developmentally appropriate for children to wear masks, and decision about how many masks should be provided daily to elementary students and secondary students. Is it a difference? Do we give our younger students more masks because we know that they may tend to take them off, to lose them, so on and so forth? Or do we provide the same level of masks regardless of age for all of our students? So I think that that's something to consider. Dr. Gerard, I see your hand raised.
Unmute. I think there might have been some talk at our last meeting about school health providing masks. From a realistic standpoint, I know we won't have all 16,000 students back in the school, but if you're speaking of a mask each day for each student, that could be upwards of 60,000 masks a week. So I think at this point also, it's realistic. Most families should have a mask of some kind. If they don't, I think we can certainly help in providing masks, but I think that students should come to school supplied with a mask.
Okay.
If at all possible. If they don't have one, of course we can help, but I think the majority of us now have a mask of some kind.
Okay, no, that's a great point. I think just the sheer quantity of what that would end up being, if we had to provide that every single day, multiple times a day, may be, I don't want to say unachievable, but it will be tough to maintain. And then from a fiscal standpoint, those budget implications would be huge. So I do see that there's in the comments whether or not fabric masks would be allowed, if we can allow, you know, children to wear those type of masks as well. I see that there's a lot of agreement with you, Dr. Gerard. Individuals should have a mask and ACBS would provide backups. So I think to that point, that's something that we would need to start engaging parents with now. You don't have a mask, to go ahead and purchase masks for your, you know, for your students, you know, in advance of this guidance coming out. Making sure that we're also providing guidance regarding how frequently to wash fabric masks, the masks that are not disposable, making sure that they're, you know, doing that part as well. And I think getting back to the equity question, we may have some students that their families do not have access to a washing machine regularly. So, you know, how are we addressing that to make sure that they still have an opportunity to have a mask that's, you know, hygienic and safe and so on and so forth. So I do think that it's important to keep that in mind. Are there any other comments for this particular item? Checking the chat, cloth coverings are reasonable. Surgical masks, of course, are not required for non-health workers. And then again, for kids that don't have one, we can provide them. And Jennifer has noted that Target has some. So I think as we are working with our families, maybe something else that we can do is provide them various resources to where they could get masks from. So, you know, I see Target mentioned, so on and so forth. I think that that would probably be a great point to have when we are engaging parents. The next item really is both student health and security, and that's preparing to train all staff, new and old, around safety related to COVID, as well as normal drills required to open and operate schools. So two of the decision points that we have for that is how do we effectively and safely train staff prior to the return of school? So what does that look like? Who is ultimately, you know, responsible for making sure that that training takes place for our staff? And then how would required emergency drills such as fire alarms, evacuations, so on and so forth occur given social distancing guidelines? Dr. Gerard, I see your hand raised.
Yes. So following this call at 11:30, I have a call with the MRC coordinator, the Medical Reserve Corps coordinator with the Alexandria Health Department, and it was suggested on a prior call last week with the VDOE and the VDH that we tap into our MRC coordinators to come into our buildings and help to train staff, parents, whoever would need this for kind of all COVID related education. So I will be meeting with that individual in a little over an hour just to talk about partnering with them for ACPS staff COVID education.
Thank you, Dr. Gerard. I see two other individuals have their hand raised, but I can't see who it is. So Marcia, do you see who that is?
Michelle Hopkins, and that's who I see from my.
Okay.
So my question is for you, Dr. Hart. It's when it comes to I was looking in the chat and it was talking about how a lot of protective or PPE items are on back order right now. I am thinking we do have a sense of immediacy for protective face shields and clothing, especially for our therapists and teachers that are dealing with students with more complex needs. So is this something that is going to be put on the priority list? Are we doing this now, or are we talking about this and then running into more of a back order?
That's a great question. So ironically enough, I already tapped both Mark Carlson and Ruth Clark to start looking at this proactively, to start engaging our vendors to see what's currently in stock. What the length of back order is, if they do have items that are on back order, so we can have all of this information up front, and we'll have to make a determination regardless of model selected. Do we go ahead and proactively purchase some of this equipment so we have it readily available? So that process is ongoing proactively because we are trying to get ahead of some of the supply issues that we know we're going to run into, just because everybody is trying to get the exact same things. We've had a few community members that have actually reached out and that have offered to help us in terms of donations, donations of PPE, connecting us to other suppliers that may have an abundance of PPE. So we're getting that information in, and as so we are engaging those individual community members as well to see if that can be an additional resource used. I see a few items in the chat, and Mark and Ruth, I don't know if you want to respond to that as well. Mark, Ruth, do you have anything to add to that?
Yeah, I mean, we've been working on ordering PPE for some time now. I mean, hand sanitizer, dispensers, gloves, masks. A lot of stuff is tough to get. I'm not going to say we can't get it, but it's not easy. So we're pressing forward, doing the best we can.
Yes, and so I think with that also, we can tap into our neighboring, divisions as well, and just say, try to see what suppliers they've used. I definitely feel like it's a sentiment that we're all in this together. One norm that I've seen through some of my own research is that some divisions are ordering 10-week stock supplies at one time. So, at any given time, what we're ordering is just 10 weeks worth of supplies. And then deciding, moving forward, if they have to continue ordering at that level, if they need to increase or decrease. But that has been one of the standards that I've seen thus far in terms of keeping supplies on stock. Carmen, I see your hand raised.
Just a quick comment to go back to the security part of the questioning. I was just thinking about if we're placing up the appropriate signage around the schools, is there a way that security can then begin to possibly train security officers and or other staff members about how to properly enforce students, maybe other staff members, about adhering to the signage and students and properly enforcing the interaction with students about enforcing the signage as well?
I think that's a good point. I don't know, John or Dawn, if you have any initial comments to that, but I think we should add that as a decision point.
Yeah, this is John. It depends on what the signage says. I am dealing with something at TC, so I had to, I didn't hear the part about signs, but yeah, it would depend. It would take a few times to discuss those points.
Okay, so the opening part of that, John, was just that as we have signage placed around schools regarding social distancing, maybe directional signage in terms of, one-way hallways, so on and so forth, what would be the ability of our security staff to really help with the enforcement of that at the schools throughout the day?
Yeah, my initial comment is we do already have posts. Let's take TC Williams, for example. There are already posts where our security officers stand to enforce other things. So yeah, it's not a problem. We could, but a lot of the commands are verbal. So whether students comply or not that's where administrators get involved.
Okay, so we will, I think that there will have to be probably to some extent a collaboration between both security and administrative support as well to help with the enforcement. And that's something that we will have to, of course, work on, fully understanding what the implications would be for both and the best process moving forward. Because, enforcement is going to be something that we are going to have to be very aware of as people are in our facilities. So I think that that's a good point, and we just need to make sure we have that under the decision-making process. We're going to have about 4 more minutes to just cover this next part, these next few items, so we can get into the essential questions. Manya, I see your hand raised.
Actually, I'll wait till later since time is short.
Okay. So the next item very quickly is cleaning and maintenance. So air quality, filtering the air, our HVAC systems and the age of buildings, HEPA filters, adequate ventilation, and knowing that we're probably going to have to do an individualized school plan for each school because every school has a different HVAC system, different ventilation means, so on and so forth. So one of the decision points is how will we assess and then complete the air quality plan per school prior to return? So Nicole, I know that I've asked you to join as well to help with some of this conversation. That'll be something that you're gonna have to work very closely with Mark and Anita on in terms of what recommendations we put in place from this. I've seen different thoughts about, about having windows open, not only on buses, but in the buildings throughout the day. But when you do that, that also has a significant impact on humidity in the building, which could create an atmosphere for mold, which then exacerbates indoor air quality issues. So it's not, as simple as I think some people may, take it for. There are a lot of nuances when it comes to our systems and how do we make sure by building that we are increasing adequate ventilation, that we are using the best filters to catch any, aerosol particles that come from, people talking or interacting with one another. Whether or not we will have windows open throughout the day is another decision point that we may want to add under here, John, because I know that that's something that a number of school divisions are contemplating right now is in terms of having windows open. Okay, so I do see in the chat, going back to enforcement, that we may want to add a section in the code of conduct to assist with clarifying the expectations for students when it comes to social distancing. Oops.
Yes, I'm glad they brought that up because the code of conduct is becoming a larger topic that we will be meeting about. So yeah, that's
okay.
Adding that in there.
Okay, great. And so if I don't see any other items for that, the next item we have talked about in another block further up in the document regarding, again, school discipline and trauma-informed approaches and social distancing, compliance with wearing masks, hand washing, etc. So, we've said that instead of naming a discipline, we wanted really pointed intervention and support. How are we going to be proactive with that particular piece? So we've definitely had conversation on that. I see that it's duplicated in the document, so I'll just make sure that we condense that to one block and have that full decision piece in one area. And then the last item that we have right now as a theme are, what is our contract tracing plan going to be in the case of a confirmed case of COVID-19 within the school or facility? And so how will we contact trace in the case of a confirmed case within a school? I don't know if we have any of our medical professionals that want to speak to that, nurses, just really what plans could we put in place? What other decision points would we need to have for this particular item? Do we have any feedback on?
Sorry. I'm trying to do the raise hand.
Okay, Elaine.
Sorry, too many buttons going. That is one of the issues that I will address in an hour. So if anybody has anything specific, I'll be glad to discuss that with MRC and the health department.
Okay, and John, that goes in the box below. Yeah,
And
that's
just to
in,
chime in, I wrote this in the chat, but I think it's really important. Most cities, and I know DC for GW, for the university, we wanted to develop our own contact tracing system for the 35,000 people at our university returning to campus.
mhm.
And the health department said no, and there's a good reason. I think that if we have multiple contact tracing systems, first of all, there's no way ACPS could do as good a job, but the
Mhm.
health department is designed to do that. They engage with the families. There's a whole community level effort, and also for surveillance, it makes much more sense. It also stops ACPS from being the people to quarantine people. You don't want to be in the business of our nurses are the ones to say your whole family's in quarantine now. So I would say that's a great partnership area, and we should task all of this to the surveillance systems already in place.
Okay, thank you, Manya. Jody?
So I was going to second that. So I don't think that ACPS is going to be doing any, contact tracing per se. We will certainly be in contact with the Alexandria Health Department, give them information about, where the student was, what classroom, school, those kind of things, and assist in any way we can. But I wouldn't call that official contact tracing. Our immediate response would be to call the health department and ask them how we could assist them.
Okay, great. Thank you for that. And I know, Dr. Gerard, you'll be able to follow up with us as well after your meeting today on some of the recommendations. So thank you, Judy, and thank you, Manya, for that. With that said, we're a little late, but we got through the initial part of the decision point. So I thank you all for that level of engagement. I see a few items, okay, in the chat, and that goes back to the contact tracing. So wanting to jump into the essential questions, which I hope everyone had an opportunity to view, at least, proactively. If not, we can jump right into it today. So I'm going to open ours. And the purpose of this particular item is to go through what are deemed essential questions for our group, identify which core area would need to take care or be accountable for this particular item. The VDOE has actually already identified the priority. There's a column whether or not we can answer this question now, and then back to accountability, who is the responsible person if we want to add a team and or name for this particular item. So just wanting to go through each question, moving left to right, answering these few questions, and hopefully we can get through most of the document before 11. So with that, the very first question is what policies, regulations, and practices should be in place to address potential health issues related to the reopening? An example, what will a school do if a student or staff member tests positive for COVID-19? So that really was a great segue from our last question. My recommendation is that the core area that would be responsible for answering this question would be student health. Does everyone agree with that? Okay, John, are you, yes?
Yeah, I was just going to ask you, where am I going to on the workbook? Where am I?
Okay, so if you go to section 2 in the workbook, John, and if you click on where it says review essential question bank of essential questions, you can click where it says here.
Yeah.
And then it'll take you through 2 additional steps to actually get to the question bank link.
Okay, got it. Which one are we on? The first one?
We're on the very first one. So I'm trying to get back to, sorry, let me get back to sharing my screen. I just want to make sure that I can click on the appropriate. Okay, I'm going to get to public. Okay, there we go. Yep. Are you in this part as well, John?
Yes.
Okay. So we're under aligned core area, and we're saying that that will be student health.
Hold on.
If you can't get to it right now, John, I'll type in the meantime, because I don't want to belabor the exercise, but just let me know when you're able to get to it.
Yeah, the first one, what are your plans for collecting, refreshing, distributing devices to students? Is that where you're at?
No, I don't know if you can see my screen that's shared. We're on this question right here, where my mouse is hovering over.
No, I mean, it's so small. You have to tell me where you're at.
Okay, don't worry about it. I will try to multitask. It's okay. We'll catch up with it later. Can we answer this question now? My initial thought is going to be no, we cannot. Does everyone agree with that?
Yes.
Okay. And then who would we want to name as the responsible person within the team to take on really gathering and formulating an answer for this question? Anybody want to volunteer? I hate volunteering, so if anybody wants to volunteer, I appreciate it.
Sounds like our Dr. Gerard and maybe Dr. Sinha and the nurses, perhaps.
Okay, so
maybe Manya and Karen.
Yeah, I'm happy to join that. This is Manya.
Okay. Sorry, I'm typing with one hand over here.
If I can help out in some way, do you need me to get in the document?
If you can, that would be great.
Okay, I'm there, Dr. Hart, where you're at.
Okay, so let me just make sure. So can you click on where it says align core area for the second question, John? So I can make sure that we're on the same, thank you. Okay, so the second essential question is, what is your plan for how you will respond to suspected COVID cases within a school facility or on a school campus to include protocols for communication and quarantine? Again, I think that this would ultimately land with student health. I do not think we can answer this question now. So if we go to column F, John, and if we can just select no for this. And I would say it would be the same responsible parties that were noted above. And what I will do is I will ask student health if that needs to change, or if you want to assign different people based on these questions, that's fine. But for right now, just wanting to put a placeholder right there. And Jody, I see your hand raised. Oh, okay, sorry. Okay, you don't have a question, good.
Sorry, I didn't unraise it.
That's okay. The next item is, do you have a process for data collection, such as absenteeism, health office, clinic visits, exclusions due to illness, reporting COVID-19 incidents? So I think that this would definitely be student health. And I would, defer to the nurses and Dr. Gerard. Do we already have a data collection mechanism in place for not just for COVID, but in general for any of our other health issues that we deal with?
We use Welligent as an EHR, electronic health record, to capture our data. The absenteeism would most likely be the administrative office of the individual school.
Okay, I see Dr. Moore, you have your hand raised, or excuse me, Charmaine.
Yeah, I just wanted to add the social workers monitor attendance, so they deal with all the absenteeism issues, the truancy, and they work hand in hand with the front office, but they're the ones who are primarily monitoring that.
Okay, I see some others have their hand raised as well. I just can't see who it is, I'm sorry. So Carmen, I see your hand.
So to extend what Dr. Moore stated, the administration would absolutely also need to work with student health and with the social workers to identify methods for releasing students who are showing COVID-19 symptoms, and making sure that there's a streamlined process for that as well.
Okay, great. So John, under Align Core Area, if you could have student health / school administration. And this is going to be one area that I will have to tap into the cross-functional team of CNI to make sure that they're part of this response as well. And I think in terms of if we can answer the question now, I don't know if we're fully ready to say yes. I know that we, Dr. Gerard, you've mentioned Welligent, I believe you said was the name of the system that we're using. I'm assuming, and again, please correct me if I'm wrong, would we be able to use this particular system as well for the COVID piece? Is that something that we could use, or would we need to tap into a different type of system for COVID tracking or incidents?
So I'm also going to request the input of the 3 nurses that are on the line, given they are our expert users. but it wouldn't have a diagnosis of COVID. We could break it down by symptoms or health conditions, but it wouldn't have COVID per se because we're not doing any testing in the clinics.
Okay. Any feedback from, nurses, Jennifer, Jody, Bessie?
It's tricky because if we wanted like the attendance office or administration to be able to see who we were monitoring for COVID, they wouldn't have access to that in Wellington. Only the nurses have access. So I think this needs to be a little more collaborative and accessible to other people, because if a student shows up and they're not supposed to, somebody needs to know that besides the nurses.
Okay, thank you for that. Jody and Bessie, did you have anything else to add to this particular essential question?
I would say because parents call in, oftentimes they'll just say their child is sick. We need to ask more or, more questions about what are the symptoms at this particular time in order to gather that data. Because
Okay.
like I say, a lot of times, you just get a call, my child isn't coming because they're sick.
Okay, thank you for that. Dr. Gerard, I see your hand.
Yep, I was just going to say, at least where my child is in school at Lake Braddock, which is in Fairfax, there is a message on the attendance line, and you are requested as a parent, whenever you are calling your student out, if at all possible, list symptoms so they can sort of start tracking if there's clusters of abdominal pain, fever, bowel changes, things of that sort. They can monitor for a cluster. If that's not already being done through a message on our administrative attendance line phones, we could request that.
Okay, great. Kafaya, I see your hand raised.
Yes, I know we're talking mostly about students. What about employees when they call off?
So I'm not sure if that's one of the essential questions, but I definitely think it's something we can note. So I will make note of that separately in my notebook right now, and then circle back to make sure we add that as a decision point in the other part of the document. So let me do that right now. Okay, so right now we don't have anyone to assign to that, John, so we can move on to the next essential question. And that's, what are the criteria ACPS will use to monitor and measure the safety, health, and student wellness, wellness of students, staff, and family. So this kind of ties into your question, Kafaya, that you just asked as well. Again, I think that I would recommend that this would be a collaboration between student health and school administration. I don't think that we have answers to this right now. Would you all agree that we don't have answer in terms of what that criteria would be just yet? Okay, I see that there's some APS guidance already out for this, but it needs to be revised for COVID. Carmen, I saw that as your comment. So I'm saying that we don't have an answer for this right now. And John, if we can just highlight the same individuals from student health, but again, we can go in and change those assignments, just wanting to have something in that box. You should just be able to hopefully copy and paste. There you go. Sorry, trying to check the chat as well. Okay, you would say, Charmaine, all of SST. I'm sorry, what does SST stand for, Charmaine?
Support team.
Thank you.
Student support teams.
Thank you, stakeholders, because, okay, great. So I think for this, to that point, John, let's add for number 5 in terms of the core groups, let's add an additional slash and put SST as well, after school administration. Okay, and then the next question is, have you conducted an analysis of the feasibility of conducting screenings of occupants prior to entering buildings? What are the ramifications of this approach? So I would put, in terms of accountable, core focus is really the entire team, the health and safety team for this, John. In terms of, okay, in terms of if we have an answer to this, I would put at this point, I would put unsure. And the reason why I'm saying that is because we had a lot of conversation today about the feasibility of doing on-site screenings and maybe the possibility of just allowing only self-screening or doing some sort of hybrid approach where we're taking a sampling method. So I don't believe we have a firm answer to that yet, but we've made a lot of headway in this particular area. And so in terms of accountable, the person that will be accountable, it's going to be, again, the health and safety team. That's going to be a group effort.
Dr. Hart, for that question itself, is this group going to determine whether that essential question remains or can be changed? Because it sounds like that one. It sounds like that one. The feasibility. If we're not able to properly track, someone had mentioned that tracing could be done better by other entities. Is it something that ACPS is going to take on? Or can that question be changed?
I wouldn't change the question, but I think that that's just a caveat to the question that we would need to add in terms of when we're thinking about the feasibility. I think first and foremost, we have to make the decision in terms of what screening model we're going to employ. And then based off of that decision, it's really going to determine what additional community supports or community help can we engage in order to, to actually execute that particular model. So I think it's a two-parter, but we have to answer the core question first or the essential question of, have we conducted an analysis on the feasibility? And I don't think we're there yet. We've done an informal analysis, but we haven't done anything formal quite yet. Does that make sense? I just want to make sure I'm answering your question. Yes. Okay. And yes, to Marcia's point, we are already doing a level of screening anyway for those that are visiting the facility. So we have somewhat of a screening process in place, but that would have to be much more expansive for the reopening process. So moving on to the next question, what are the varying wellness, health, and safety measures we will need to put in place for the different age levels and populations, for example, primary, intermediate, middle, high, special ed, English learners, Title I. This really, I think, is not just going to be a conversation with student with the health and safety team, but also with curriculum and instruction. I think that this is going to have to be a heavy collaborative conversation for this particular piece. So I would put down both of those groups, John, health and safety team, and curriculum and instruction.
See offline for a second, maybe.
Okay, I just want to make sure that we're in the right. Michelle, I see your hand raised.
I would like to work in this group, please.
You said, I'm sorry, you said you would like to work in this group?
Yes.
Absolutely. Okay, so thank you, John. I would say no, we don't have this question answered yet. And right now, let's put the accountable person right now is Michelle Hopkins, Dr. Michelle Hopkins, but we can add to that team as well. So Michelle, one of the things I'm gonna ask actually not just you, but everyone to do for our next meeting is when we come back to finish this particular activity, to just note who it is, who else you think should be part of that conversation to answer that particular question. Whether it's within our team or outside of our team, we may just need to note that so we have clear understanding of who would help really formulate a final answer to that question. The next item we have is what short-term and long-term safety measures will be necessary if we reopen and continue throughout this coming academic year, such as social distancing, sanitation practices, classroom building cleaning. John, again, I think that this will be our entire team. I would not say that we have an answer to that quite yet. We've talked about a number of measures that we can employ, but I don't believe we've landed on anything yet. And for right now, let's put a marker as the entire health and safety team as the accountable parties for that, and we can define that more when we come back on Wednesday. We have 9 minutes, so just trying to get through some of these other essential questions please feel free to chime in at any point. I'm not trying to, again, rush the conversation. I just want to make sure we're keeping on track with what our deliverables are as a team. So the next question is, have you contacted your cleaning supplies vendor regarding the availability of supplies and equipment? So this will definitely be the PPE focus group. Mark and Ruth, would you be able to say that this question has been answered? Yes, we have contacted, no, or we're unsure. Where are we at with, wait a minute, I'm sorry, the question went away. There we go.
I'm sorry, I have a problem with unmute.
That's okay. So Ruth, where would you say we are with this particular question?
Yes, we have been contact our vendors for PPE supply, but I'm not sure about equipment. What equipment are you referring to as for part of PPE?
We can define that as we are going through the process, but I think I can't think of anything right off of, you know, the bat. Maybe I do know I've seen some schools that are looking into it's a sort of plexiglass stanchion that can be put in place when you're doing physical temperature screens that separates you from the individual. Your thermometer, there's like a hole cut out where the thermometer can go, you know, in that hole, you're able to take the temperature, but not, you know, be right on the person. So that's just an example of equipment that they may be referencing. You know, portable hand washing stations, we talked about that earlier, hand sanitizing stations. So in terms of the accountable person, John, please put Ruth Clark and Mark Carlson. Okay, I see that Nicole has also added fit testing equipment for nurses. Nicole, what specifically are you meaning? Fit testing for the N95 mat? What are you alluding to?
Yes, if the staff, if any of the staff will have to wear N95 masks, they have to conduct the fit test. It has to be a qualitative testing.
Okay, so are you saying, I guess I'm trying to tie that back to the essential question. Are you tying that back to the question that we're answering now, or is that just a point that you're putting in the chat?
No, it's with that question that you're answering now because of you put the availability of the supplies and equipment. So you should probably put in to have the machine there.
The fit testing, so it's an actual machine is what you're saying.
Yeah.
Okay,
yeah.
So let's not change the question, John, but I'm gonna also then add you to this group, Nicole, because if that comes up, then that would be something that I will ask you to work with your, you know, with your connections to reach out on for that particular piece of equipment.
I believe Dr. Gerard has already been in contact with someone about fit testing. Correct me if I'm wrong, Elaine.
So I've spoken with Dr. Sinha, and there might be a contact through the Fairfax Fire Department that we could get.
Okay.
Dr. Sinha, are you on the call still?
Yeah, I'm. There's a couple of different contacts that I'm looking at. Alexandria Fire Department. I've been in contact with their medical director. I don't have contacts at the Fairfax Fire Department. I do have contacts with my. I'm part of a federal disaster team, so I do have contacts, and I just got fit tested this past weekend, actually. So there is the possibility of having a team of fit testers come in privately. And they can fit test several hundred a day, depending on what we need. That's something, Elaine, you and I can speak about further offline about what the needs are, but we'll circle up on that.
Okay, thank you for that. And thank you for mentioning that, Jennifer. So John, can you also add Dr. Gerard in that as well, and Dr. Sinha to help with the fit testing equipment? I think that Ruth and Mark can handle all of the other PPE, but if they already have, you know, some potential contacts for that piece of equipment, I think it will be good to add them to that category.
Thank you.
Thank you. And so I think we're only going to get to question 10 today. And this question is, have you planned protocols to conduct traditional school health services expectations such as immunization, sport physicals, vision, hearing screenings, related health services for special education students, etc.? Wow, I don't think we touched on this specifically during our decision point. So I'm going to ask the team, who should this ultimately fall under? Would this be student health? Would this be a combination of some other groups. What is your feedback on this?
Yeah, I'm thinking student health and Dr. Hopkins as our special educator on the team.
Okay. So John.
James Parker as well.
James Parker, okay, thank you. So John, if you can put student health, and in parentheses, we want to make sure that we include Dr. Hopkins and James Parker as well. And I'm assuming that we do not have an answer to this question yet, or are we unsure if we have an answer to this question yet? Okay, I'm saying no. I'm seeing Carmen shake her head no, that we probably do not have an answer to this question. And again, in terms of the accountable parties, John, you can just copy and paste what we have under for the core team, student health, Hopkins and Parker. I think that would be good. So it's 10:57. We probably can get to this one last question and then I'll wrap up today's meeting. Have your school health personnel completed training on contact tracing? So Dr. Gerard, nurses, do you want to speak to this piece?
So for those of us that, anyone who needed to do contact tracing through the Alexandria Health Department, there were 2 courses that we needed to complete. In addition, there's an excellent one through Johns Hopkins that I've just done again. That's a 6-hour course, but it's very good. It's free. If anyone would like to do it, contact tracing through Johns Hopkins. But additionally, if we're going to have the health department do that for us, it's probably something good to know, but we won't be enforcing that piece of it. I think we said we were going to have the health department do that.
Yes, I think the question is just not specifically in terms of who is going to do the contact tracing, but just asking if our personnel, school health personnel, have been trained on that.
Those, I would say a third of them have, and we can make it something that they all, I guess that they all would need to do. But again, I'm just thinking if they're not going to enforce it, there might be a better use of their time.
Absolutely. Okay, so John, let's put this under student health. I know we have Dr. Gerard, and thank you for putting the note that 1/3 have. So it doesn't give us any other options between no, yes, unsure, and not applicable. But so it really doesn't kind of speak to our unique situation, but I think it's important to have that note in there that 1/3 of our staff has been trained just because of our current, how we, went into COVID, I don't want to say our immediate closure COVID model, but after March 13th, we know that a lot changed in terms of what it is that we were having to support throughout the city and for the division. So with that said, we got through a lot today. It's 10:59. When we circle back next Monday, the first part of that meeting, and we really will probably only have to keep it to about 20 minutes so we can meet our other deliverables, will be to finish this list. I believe there are a total of 30 questions. So again, please take some time to get through the document, to just kind of look at these items. I will be doing some reformatting of the actual chart that we just worked on to make it more sequential so it flows better in terms of our decision points and our answers. I will be emailing probably either tomorrow or Friday if there's any additional guidance that comes up over those 2 days to the team. I will be sharing, again, information that Jody had shared with me in terms of one of the documents that she proactively went in and, put some discussion points in that document. So I'll be sharing that information as well. And again, if you have any feedback for me, please feel free to email me and just let me know what's working with our conversations, what we can be doing better to keep us on track. And I will take that information and I will definitely employ it. So I thank everyone again today for your time. I thank you, Carmen and Marcia, for helping facilitate today's meeting as well. I hope you all enjoy the rest of your day, and we will be talking soon, so take care.
Thank you.
You're welcome.
Thank you. Have a good day, everyone.
You too.